There's no evidence that shows that giving prophylaxis lowers the rate of babies getting herpes. And they say that because there were no cases of symptomatic neonatal herpes in any of these 7 studies.
With the placebos included.
Right.
Yeah.
None of the babies got herpes in this study, but women who received the antiviral prophylaxis were significantly less likely to have a recurrence of genital herpes at the time of delivery.
Okay, so some people had an outbreak, but none of the babies got sick.
That's correct. Women who received antiviral prophylaxis were also significantly less likely to have a cesarean delivery for genital herpes. That may be because the indications for doing a cesarean section are not standardized. We don't really know. I mean, there are still physicians I know who tell a woman that if she gets a herpes outbreak and she goes into labor within 7 days, she should have a C-section. But that's not really what I found. If the lesions are gone or the symptoms are gone within 2 or 3 days, and we're talking about recurrent herpes now, not primary herpes, then it really should be informed consent. And you really can't give informed consent because no one really knows what to do in that scenario. Then you have to weigh the risks of cesarean versus the small risk of potentially giving your baby herpes, which could be quite serious.
Yeah.
But nobody knows.
But I was told, Stu, that the concern is that you may have a lesion internally that can't be seen.
Yeah, that's what I've been told. I couldn't find that anywhere.
That's possible, you mean?
I couldn't find confirmation that that's a reason why you should do what you should do. I think that was something that I was told all the time. Well, if they're shedding virus on the outside, maybe they're shedding virus on the inside. But nothing I could find in any research actually confirmed that. So that may have been something that was said once and just got propagated over and over and over again. And again, we're talking about genital herpes here. This is herpes on your labia, your clitoris, your vulva, that sort of area. We're not talking about herpes on your lower butt or on your back. We're talking about herpes simplex here. We're not talking about shingles or in your inner thigh or that sort of, or on your lip or anything like that. We're not talking about that sort of herpes.
Right.
It has to be genital herpes. And if the lesion is anywhere else, like say it's on the inner thigh, that is not a reason to do a C-section on anybody. You can cover that with some sort of plastic adhesive drape. But that's not something that a lot of doctors will tell their clients. They'll tell their clients, their patients, that, well, if you got any herpes outbreak and you go into labor, or you're in you're 39 weeks and you get an outbreak, you might as well just have a C-section.
Yeah, not considering the risk of the C-section itself.
Never.